Hi everyone. Today we are going to discuss about renal transplantation. First, definition of renal transplantation. Renal transplantation is the most preferred method of renal replacement therapy for patients with end-stage renal disease when the GFR means glomerular filtration rate, is less than 50 ml per minute. Patient became dialysis depends for the life. It's so renal transplant and should be offered to be restore the quality of life. Next, we are discussing about the indication of renal transplantation. Dialysis depends end-stage renal disease from first the indications are the first indications is means diabetic nephropathy, then hypertensive nephropathy or hypertensive nephrosclerosis. Then the fourth point is chronic glomerular nephritis, then chronic pyelonephritis. It the last one is the adult polycystic kidney disease. That it means the bilateral renal malignant tumors when the nephron sparing surgery is not possible, and the traumas in single kidneys when preservation of the kidney is not possible. These are the indications of the renal transplantation. Next, contraindications of renal transplantation indicate active infections, TB, CMV, EBV and V. Z is it's a hepatic B and disease virus. Then the active malignancy or recurrent malignant disease. It's a severe obstructive and restrictive lungs disease. Then severe pelvic vein thrombosis or atherosclerosis of Licca vessels or contraindications of renal transplantations. Then the types of donor. There are two types of donor. First one is living donor. Then second one is brain dead donor. Organ donation from living donor. First, the act prescribe that living persons when healthy and has mental capacity can donate his organ. The blood parts of close to related is not likely to disrupt their ability to live a normal life. Then it also prescribes that the condition does not apply to transplantation of the eye, skin and tissue or bone marrow. It's been a close relatives according to the act. First one, donate person first degree blood relatives, parents, adults, sons and daughters and brothers and sisters are given. Then second degree blood relatives included uncles and aunties from the both parental and maternal side. Next, third blood relatives spouses. It includes the certain other relatives such as grandparents or grandchildren or first cousins, including the list on the revisions of Act in 2018. Next, if the donor and recipients are not close relatives as set out in the act of donation, it is not legally allowed. The second one is brain death donor. Brain death donor is defined in the terms of permanent functional death of the brainstem as neither consequence nor spontaneous respiration is possible in the absence of functional brain stem. It be a declaration of brain death. The act authorizes a brain death committee to declare the brain death included three physicians with the rank of professor or associate professor. First one is medicine or critical care medicine. Second one is neurological and third one is anesthesiological. None of those members or committees or clause The clinical testing of the brain stem's death means the absence of cranial papillary reflexes, nerve reflexes, corneal reflexes, pharyngeals, and tracheal. This means cough reflexes or caloric reflexes and oculovestibular. The absence of motor response to painful response and it stimulate to apply the head and face. Then absence of the motor response without the corneal nerve distribution to adequate stimulation of any somatic area is an indicator of brainstem death. The presence of spinal reflexes does not preclude the brainstem death. Next, the absence of after pre-ventilation with the 100 percentages for at a spontaneous least 5 minutes. The patient is disconnected respiration from the ventilator for 10 minutes to confirm the absence of respiratory effort during which the time arterial PCO level should be greater than 8 kPa and 60 mmHg to ensure the adequate respiratory stimulation. To prevent hypoxia during the period and the O2 its oxygen level 6 L per minute is delivered via an endotracheal catheters. Next, after declaration of brain death by the committee, first the brain declaration committee will inform the transplantation coordinator and above associated professor required by government. Then the transplanted coordinators will inform the medical board to take necessary action for the transplantation. Then medical board formation, it's related to subject professor, experts in surgery, associate professor in anesthesiologist, director of the hospitals or nominated person. Next, eligible donor. Eligible donor means brain death declares for cadaveric donors and age to 2 years to 70 years old. The cadaveric donor, it should be age means 70 year, as the living donor for age 18 years to 65 year. The section will not applicable for eye, skin, tissue and bone marrow transplantation. The basic criteria for donor selection: first of all, absence of renal disease, then absence of active infection, next absence of transmissible malignancy. Then the not eligible criteria for donor: the patient have written objections about organ donation before death, and the patient was HBsAg or anti-HCV or HIV positive. The medical board was declared as not eligible. Then the presence of cancer, expert primary CNS or skin cancer, malignant hypertension, insulin dependence, diabetic mellitus and chronic kidney disease. Next, the end-stage renal disease. End-stage renal disease recurrences. It means primary oxalosis, it's IgA nephropathy. The primary oxalosis included certain end-stage renal disease conditions. First one, IgA nephropathy, cystinosis. Then the renal disorder condition is systemic lupus erythematosus and typically hemolytic uremic syndrome. Then anti-glomerular basement. Next, the membranous disease. The other condition is focal segmental glomerular sclerosis. It's a condition of renal disorder. Then anti-neutrophil cytoplasmic antibody Anti-neutrophil cytoplasmic antibody means ANCA associated with vasculitis. Then proliferative glomerular nephritis. Then membranous nephropathy, renal amyloidosis. These are the conditions like end-stage renal disease. Thank you.